Uh, Welcome everybody to the December Ag Behavioral Health Working Group meeting here in Colorado. It's good to see you all. Some of you, it's been a month, and some of you are new faces that I
Ya
haven't seen
llevamos un
before, and look
mes, así
forward
que algunos son nuevas caras. Oh,
to hearing from you. And yes, we have a Spanish interpreter that has joined. Richard, I will let you introduce yourself and tell people how to access the interpretation services.
absolutely. Sorry to interrupt. I apologize.
No, no worries.
Muy buenas tardes a todos. Good afternoon, everyone. Si quisieran usar el servicio de español, if you'd like to use the Spanish option, you can do so by clicking on the bottom portion. There should be an option for how you would like to listen and hear the incoming information. Sí, debe haber una opción para que usted pueda elegir lo que es el español hasta abajo. Debe haber en el menú de abajo de su pantalla una opción para escuchar exclusivamente en español.
Fantastic. Thanks, Richard. And we have people that are continuing to join. Welcome, Richard Harland from the Ute Mountain Ute Tribe. And we're going to go ahead and get started. For those of you who are joining from the general public, there should be a Q&A option at the bottom of your screen or a chat function. Feel free to put any questions throughout the webinar in the Q&A section, and we will address those as we are able. Thanks for joining us. Before we get going, I do want to invite everybody that's on the call that's a part of the working group or that's a speaker today to introduce yourself, tell us where you're from. And since we do have quite a bit of speakers today, we didn't have a question for everybody to answer. We do have Liz Thomas that's going to give us a little bit longer of an introduction. We're excited for Liz to join us from the BHA, but I thought before we got started, for those of you who know me, my name is Clinton Wilson. I work for the Colorado Agribility Project as the state program specialist here at CSU. I really enjoy breathing exercises. They're the quickest way for us to ground ourselves to ourselves, particularly in times when we need to focus or when we need to reconnect during challenging moments. So I'm going to lead us in a quick box breath. So wherever you are, if you've done box breathing before, you'll know it. If not, I'll walk us through it. But I figured that we could do that to kind of locate ourselves in this space, and then I will pass it on to the next person to introduce themselves. So if you can take an exhale just to cleanse your lungs, and then breathe in, 2, 3, 4, hold, 2, 3, 4, breathe out, 2, 3, 4, hold, 2, 3, 4. Now everybody together, just breathe in a deep one, feel your lungs filled with air, locate yourself here in this room, and glad you're here with us for the next hour and a half. And with that, I'm going to pass it to my left to Robert Sakata on my screen because he's the only person that was on the call before me. So go, Robert.
Thank you, Clinton. Hi, everybody. Robert Scott with the Colorado Department of Ag. I'm the Ag Water Policy Advisor, and I will pass it on to Dr. Zerba.
Hi, my name is Dr. Emily Zerba. I'm in Carbondale, Colorado. I own a direct primary care practice, and I'm working with Seed Peace to try to offer primary care to local agriculture and farmers.
And I will pass it from there to Bob.
My name is Bob Piscura. I'm the co-founder of Seed Peace, Casey's Fund serving farmers. And you're going to know, you may know a lot about us already, but you're going to know more. And I'm in the mountains of Virginia, right? Looking at the Blue Ridge as we sit.
Right on. Thanks, Bob. And Rosie, I'm going to bounce over to you.
Thank you. Hi, everyone. I'm Rosie Scavrin. I am the Drought and Climate Resilience Program Assistant here at the Colorado Department of Agriculture, and I will pass it to Julie.
Hi, I'm Julie Elliott, Behavioral Health Specialist with Colorado State University's Agribility Program, and I'm located in Grand Junction, cover all of the western slope. And I will pass it, just a second. have to see the screen. I'll pass it to Tim Miller.
Good afternoon, everybody. Tim Miller with the Colorado Farm Bureau, Director of Industry Relations. Our offices are in Centennial, though I'm located from the home office in Nevada today as I'm fighting a little something off, but otherwise, yeah, doing well. So, looking at my screen, I will pass it on to Richard.
Hi, I'm Richard Harland. I'm a behavioral health provider for the Ute Mountain Ute tribe down in the Four Corners area of Colorado. Um, Toyoak is the name of the town the reservation is located on, and Toyoak means thank you in the Ute language.
Awesome. How about we go to Lena?
Hey everybody, Lena Heilman, she, her pronouns. I'm the director of the Colorado Office of Suicide Prevention. We're housed at the Department of Public Health and Environment, or CDPHE. I'm also a sibling suicide loss survivor. Some of you might have known my colleague, former colleague, Catherine Harvey, who filled this seat. So we are here as OSP filling in for this seat until we are able to rehire this position. So thanks for having me here today.
Great, thanks. Wendy.
Good afternoon, Wendy Buxton Andrade, Mental Health Colorado, and I am from Southern Colorado and was a commissioner for 12 years, and so I'm glad to be here and still own ag land in Southeast Colorado.
Right on. Thanks for joining. Trent.
Yeah, Trent Woods, Montezuma County Public Health here in Colorado, in that southwest corner with Richard. Yeah, just been working on suicide prevention for about the last 5 years.
Fantastic. Chad.
Good afternoon, everyone. I'm Chad Redzenchek. I'm the Behavioral Health State Specialist with Colorado State University Extension and Agribility, and I'm located in Johnstown. I apologize for being late. I was trying to get here from campus, and there's a big old accident. So sorry if I missed anyone, but has Mr. Piscura gone?
So, he has,
yeah,
and we'll hear more from Bob later.
Perfect. All right, well, then I'll let you pick Clinton, whoever hasn't gone, but nice to see everyone today.
Right on. Neona.
Hi,
and did I say that correctly?
It's Neona.
Neona. Excellent.
Yeah, thank you. My name's Neona Phillips. I am the CNC coordinator here for Montezuma County. And so I do everything. I do suicide prevention work.
Excellent. And where are you located?
Montezuma County.
Where in Montezuma County? Just curious.
Oh, I used to live in Memphis. Now I live in Lewis. So
cool. Well, glad you could join us. And then Trent has gone. Dr. Krika.
Thank you. Good afternoon. JC Karika with Access Health Systems serving Southwest and West Central Colorado.
Awesome. I'm glad you could join. All right. Well, we may have some other working group members join as we get going, but I want to jump into our first presentation. Really glad that Mr. Piscata and Dr. Zerba can be here with us. But before we do, Robert has his hand raised, and I'm going to let Robert talk first. Go. You're muted, though. We can't hear you.
Were you going to have Liz introduce herself now or later?
Oh, my God. Thank you so much. And Liz, I'm so sorry. And we will jump into our presentation in a moment, but we did have time set aside. I skipped you intentionally, but I forgot to come back. Liz Thomas from the Behavioral Health Administration is on the meeting. And Liz, take it away. I'd love for you to introduce yourself and tell us a little bit about your role and what brought you to it.
Yeah, thanks, Clinton and Robert. So I am Liz Thomas. I am a Colorado native, originally from Flagler, Colorado, in between Lyman and Burlington. Grew up on a dry land, wheat and millet, and cow-calf operation with my dad and grandpa. So been in agriculture my entire life. Then went to CSU and actually double majored in economics and agricultural business. And while I was at CSU, I actually did an internship with the Colorado Agribility Project. And that's what really got me into the mental health, behavioral health sector, especially within agricultural and rural counties. Most of my career has actually been with the Farm Service Agency. I started out as a manager in the county offices with FSA, where we administered farm bill programs and loans for beginning farmers and ranchers, and then was recruited to the state office, where I became the state outreach coordinator and administrative officer for all of Colorado FSA. And then I applied for the position that I have here at the Behavioral Health Administration. It's the Agricultural and Rural Program Administrator. So liaison between the BHA and CDA, other ag organizations, behavioral health providers, but then also conducting outreach and researching gaps in rural and ag communities specifically, and how we can bring them mental and behavioral health. So I'm really excited to be here, really excited to meet with you all, and hopefully talk to you more all individually. I just started about a month and a half ago, so still getting my feet wet, but happy to be here. Nice to meet everyone.
Thanks, Liz, and thanks for being so willing to jump in and get your feet wet quickly. Liz showed up on her first week on the job at the Ag Behavioral Health Summit and did a great job representing. So we're glad that you are a part of this team. So now I will acknowledge that Emily jumped on. Emily will be talking in just a little bit with the group from Montezuma County, and I'm glad that you're here. And now I will pass it to Dr. Zerba and Mr. Piscara. So, seed piece.
Yeah. Okay. First of all, Mr. Piscara was my father. Please call me Bob. I don't need that much respect. First of all, thanks for allowing us to be here. I got to tell you, I feel a little small. There's a lot of professionals in the behavioral health area on this call. Rosie, thank you. Sent you out some handouts. There were three things. One of the things was modern day night. Turns out it was a story by the daughter of the rancher who my son Casey had his farm and seed operation on. And it's the reason we're here. This is a 6-year-old telling about her experiences on the farm with Casey. And if you want to put a face with a project, read that. And I won't go any more into that. We also sent you a flyer that we have. It says free mental health services flyer. And one of the things I wanted to speak to on that is we're trying to make this easy. And getting help, medical help is difficult in general. Mental health is difficult also. And I know this from personal experience, but I'm learning more and more every time I talk to somebody around this project. We were lucky enough to make acquaintance with the National Farmer Mental Health Alliance. It's actually a company in Canada. The person that runs it, her name is Lorraine Van Uck. We would call her Lauren, but her mom wanted everyone to call her Lorraine. And Lorraine has made it her life's work working with farmers who are having behavioral health issues. When we met her early on, actually, my daughter is on this project, as is my spouse. Lorraine just bent over backwards to help us. And one of the things that they do is she offered to train therapists in the Roaring Fork Valley. They have a training program called Agriculture Informed Therapy. It's designed to train a therapist on how they want to work with someone in agriculture. We've got, of the 5, we've got 3 of them trained. I've talked extensively with one of them, and they just go on and on about their experience with learning this stuff. One of the things I've learned from Lorraine was that for farmers who seek help, there's only a 10% upload, that's not the correct word, But there's only 10% of the people who seek help actually get the help. And that's the sad thing. The other thing is she says that we find that our counselors can work with people, and in general, within 4 to 6 sessions, find out what the problems are, give these people tools to work with them, and then they can go on working their life. So very difficult for these farmers to get in the system, get help. But it appears to me, from what Lorraine has indicated to me, that if they can get help with somebody who knows what they're doing and knows how to talk with our agricultural community, it can work. And Lorraine's a fabulous person. It took me 6 months to pay her because she wouldn't take any money. So it gives you a little bit of a background on that. We're working, I waved at Chad, found Chad, and we found the camp program. And what we're doing currently is making this help available, making it available free. So that's kind of where we are on there. From a personal point of view, it saddens me greatly that I had a son who had an issue and wasn't able to get help. So that's putting the real thing to it. The third thing I sent out to you was a flyer that we have. What we found is you got to make this stuff easy. I've had some fairly long experience with this kind of a program in Florida for our local Lions Club in Florida. And what we do is we provide glasses and an eye exam. It's at no cost to the person. How we've done it is we've worked deals with eye doctors and eye optical companies. But what we found is you've got to make it easy for people to get this help. If you make it, they have to jump through 3 or 4 hoops, they don't do it. So the original thought was we'd do this for Seed Peace and we'd try and find other things that, other health-oriented things. I'm looking for a dentist currently. They can help these people because they're not rolling in the dough. They're really isolated. But then, so basically what it all kind of rolled down to is seeking medical help is really difficult. And seeking mental health care for embarrassing things is real difficult, even more. Talking about mental health to somebody, your mental health is pretty tough. So when you're trying to deal with this overwhelming process, and if you realize, gee, I've got an issue, you've got to figure out, who do I call? You've got to figure out, what's the cost? Can I afford it? You've got to figure out, can a doctor understand my problem, diagnose it, and treat me in the normal 10-minute block I may get if I go to a normal MD? And do I need antidepressants? Everyone knows what they are, but would that help me? Can this person explain to me what they are and then convince me to take them? Do I need talk therapy? And by the way, I talked to Casey extensively about talk therapy over the years, about antidepressants. But what I'm finding is a lot of these people, if you're not the expert and you're just the dad or a friend, he may not listen to you. So the most important question that I ask when I have a health problem is, can I trust somebody with my life in their hands, with my health in their hands? And unfortunately, the way the system is now, it's really hard to get people who are already overwhelmed with life to put them in that kind of a position. So luckily, my family and I here in Virginia found a direct primary care doctor back 10 years ago. And the way I would tell you all to understand this, and I'm going to shut up and hand this off to Emily in a real quick second, is that it reminds you of the old family doctor. Y'all are really pretty younger crowd, but the old family doctor that you had 40 years ago. I was talking to my sister in Ohio this weekend, and she goes, "Oh yeah, Dr. Rupp. Remember him?" And I didn't, but I remembered the name. And he was the guy that you went in and he knew you and knew you played ball, and you didn't have 10 minutes, you had whatever time he needed to help you. So our our brainstorm and our aha moment on this whole thing, and we may be totally wrong, and I may want to be in on this work group if I'm allowed, is I imagine I can learn a whole lot about how to serve these farmers and how to help them, is we're serious about doing it. What our aha moment is, if we can get these farmers involved with health professionals that they trust and that they know, it's highly likely that when they see one of these health professionals, a professional may go, "Gee, Bob, you don't see him yourself. What's going on?" Or I might say, "I'm struggling a little bit. I need some help." Because the help's there, but it's taking that first step to it. So I told you we're involved with a direct primary care doctor throughout this whole thing. By the way, Casey took his life on February the 2nd of this year. So it's not been that long, but Dr. Matt got wind of it. He called our family and asked, "What can we do? Are we having problems sleeping? Are we doing that?" And he's kept up with us. So I had a friend in Carbondale. Actually, she was a close friend of Casey's, and she said, "Bob, I've got this doctor I know. Her name is Dr. Emily." And Emily, I'm going to turn it over to you. I don't know if Kat had talked to you about seed peas first. And again, seed peas is brand new. No one knew what the deal is. So I'm going to turn it over to Emily, and then if you all have questions after she talks and I talk, we'll answer questions. How's that?
Thanks, Bob.
And Emily, just to give you a time check before we get going, if 5 minutes works for you, that'll keep us on track. Thank you so much.
Sure. So I am a physician. I'm a primary care physician in Carbondale. I was contacted by Bob to work with Seed Peas to offer primary care to agricultural workers and farmers in the valley, with the idea that in primary care and behavioral health, the two go hand in hand. You really are able to help people when you have a primary care physician that is trusted with that patient and behavioral health access. And I think in this landscape, unfortunately, it's hard to find a physician. It's hard to find a physician that you know and trust, and it's hard to afford a physician. And all of those things create additional barriers to receive mental health, and to receive healthcare in general. So the purpose of my practice is direct primary care. So just like Bob was saying, I know all my patients. It's just me in the office. When people come in, I give them a hug. When they leave, I give a hug. They pay a monthly subscription that's affordable, somewhere around $100 to $150 a month, and they have complete access to me as their primary care physician. So they're able to come and go as they please. They're not charged For office visits, they can call me, text me. They have 24-hour access to me as their physician as long as they do it responsibly, which everybody does. The goal of the practice is really to be able to provide accessibility and affordability to healthcare, and this model does do that. A lot of people associate direct primary care with concierge care, which I would say the price tag is much significantly lower, but the access is the same. So I feel very honored and fortunate to work with CPs, to work with the farmers, and we've had a couple people come in already, and just the gratitude on both parts for me to be able to help them and for me to be able to be there for them has been really rewarding.
Awesome. That's fantastic. All right. Does
One of the
anybody go ahead, Bob? Did you have something else you wanted to add?
As Emily was talking, something came up to me. All of our professionals, we've got an eye doctor, we've got Emily, we've got some alternative care people that have signed on, and all of them, when I talk to them, I say, I don't expect you to do this for free. You've got a job, you've got a family, but all of them have worked with us to discount their services to a point to where CPs can cover them. So for these farmers who apply, we've taken the dollar amount out of it. We pulled that out of the equation, so they can't say, I can't afford it, because we can. And the last thing that you should know is when you apply with CPs, it's just an online application, a Google form, real simple. You qualify by receiving any kind of government benefits. That could be SNAP, that could be Medicaid, that could be just housing help in the valley, in Roaring Fork Valley. Housing assistance is a big deal because it's so expensive to live there. The other way you qualify is if your adjusted gross income is $75,000 or less. I can tell you, we just started picking numbers and bouncing them off our cooperative extension agent until we found a number that was high enough that it's going to catch a lot of people, but not so low that we're paying for people who can do this themselves. So I just want to reiterate that. I don't think I did that very well.
Great. No, that's amazing. Thanks for sharing. And the worksheets that you were talking about were sent out with the agenda. So everybody who's in the working group, if you want to view the worksheets that Bob referenced, they're embedded in the agenda along with the Seed Peace newsletter from November. And due to the sake of time, when we'll send a follow-up, Bob, we'll send your email with it. And if anybody has any questions, I'll just let them reach out directly to you about Seed Peace. But thanks so much to both of you for sharing and letting us know a little bit more about what's going on. It's very fitting for this group, and we will work hard to amplify and send that out across Colorado. So,
thanks.
Yeah, of course. And thanks for joining. You guys are welcome to stay on the meeting for the rest of the hour that's left, or if you need to jump off, that's fine too. We understand, but really appreciate both of you guys joining us. And before we jump to the next section, Rosie didn't scream up too loud when I skipped the minutes from the last meeting, which
I was biding my time. I was going to wait until the end.
Well, I don't want us to get too far off track. So I want us to approve those minutes. Rosie sent them out in the last email. I hope everybody was able to review them. We did add one person to the attendance that was on there. Does anybody have any other additions or edits that need to be made before we approve them?
I would just say that I'm not acting commissioner yet. Just I saw that on there, so
Not yet.
Not
okay.
yet. Exactly.
Maybe I'll make an edit. Soon to be acting commissioner Robert Zakata.
Add the soon to be. That's right. Your schedule sure does seem like it.
Thank you so much, Emily and Bob. We really appreciate you taking the time to be here.
Absolutely. Okay, so without any other thumbs down or edits, we're going to approve those minutes and move on to our next group. from Montezuma County, and Niana was on when we did intros, and Trent is also with you guys. No, Trent is with you guys, but Emily has joined and Madison has joined. So I'm going to let you guys introduce yourself as you guys start presenting. So the floor is yours. Thanks for being here.
Thank you. I just realized I did not send Rosie the presentation. So do we need to share the screen or?
You should have the ability to share the screen
Oh,
if you're able
okay.
to.
Let me do that then. So everyone can see this, right? This.
Yeah, looks great.
You can see it. Looks good.
Thank you. Sweet. Well, again, my name's Niana Phillips. I am the CNC coordinator here for Montezuma County. We are part of the Western Slope and part of the Four Corners area, so very low Colorado. And then I'll just pass it to the people who are a part of this as well. So I'm gonna do Emily Lockard, if Emily can hop on.
Sure. Hi, everyone. I'm Emily Lockard, and I work for Colorado State University Extension here in Montezuma County. I'm the county director and ag specialist. And yeah, glad to be a part of this team down here.
And then Madison Mahaffey.
Hi there. Yes, Madison Robinson now. But I am the chair for the Connectedness Work Group with SAFE. The Connectedness Work Group is the work group that's putting on our cattle, crops, and coffee program. I am stationed here at the probation department, actually, for the 22nd Judicial District. So that is both Montezuma and Dolores counties. And yeah, thank you for having us here today.
And then I'll pass it to Trent.
Trent Woods again, Montezuma County Public Health. My main lane is emergency preparedness and response management, but I also have been working on the suicide prevention and postvention areas for the last few years. And so I support the SAFE Coalition through looking at and evaluating data, working on postvention, and of course connectedness now.
Thanks, guys. So we're going to present on our agriculture part of our SAFE program today. So like I said, we're based in Montezuma County. We're called the SAFE Coalition. That stands for Suicide Awareness for Everyone. Here you'll see our new ag logo that we've created for the agriculture community. So just a couple things, because I know that many of you are from different parts of or from Colorado. So about Montezuma County, Montezuma County is located in Cortez, Colorado. It's known for its rich rural cultural history and its strong agricultural community and the stunning landscapes. As you know, Mesa Verde is here. And it's also part of the Four Corners region. Our community has about 26,000, according to our health assessment that we've recently taken for Montezuma County. I kind of just want to talk about our agriculture because Montezuma County is agriculture and it's a very big part of Montezuma County. So there's a total number of 1,017 farms, land and farms. So this is acreage. There's approximately 686,000 acres here. The average size is 675, and then the number of producers is about roughly 2,000. And then we got this information from Emily Lockard, which is the ag census here. I kind of just wanted to talk about our projects. So here we're presenting on, again, our agriculture part of SAFE. So we had designed this new ag logo dedicated to the agriculture community. We had promoted a program called Cattle, Crops, and Coffee last year, or the beginning of this year, and is now restarting at the end of this year. And then we're going to get to talk about a little bit about the SAFE drawing for the agriculture community and the survey that we've conducted for the ag community here as well. So here you can see our original SAFE logo. It was created about 5 years ago, maybe almost 6 years ago, with the SAFE Coalition. We wanted something that was tailored to the community. This was made before I got here, or before I became the new coordinator, and then we switched over to the Safe Ag logo. We're thinking actually about adding new logos here and there for different populations, just so that they feel included. So we basically made this logo specifically to promote our cattle crops and coffee program. We created this distinct program recognition to better connect with men in agriculture and the ag community as a whole, because we also think like this little flower is not gonna connect to, people in the agriculture community and specifically men in ag as well. It has allowed us to meet our goals, which is effectively engage our community audience. It's fostered stronger community connections, and it highlights the unique focus of this program within a broader mission as well. Going on to talk about our cattle, crops, and coffee program. It's a collaborative effort led by the SAFE team. So SAFE as a whole, and then as Madison mentioned, we have work groups in our SAFE coalition that handled specific different things and tackle specific different things within our coalition. And Connectedness is right now tackling the agriculture community. So this is where cattle, crops, and coffee stemmed from. We basically it started off as a pilot program here. In the beginning of the year, these are the first sponsors that we got here locally for Montezuma County. A lot of them donated money, some donated caps, beans, gift cards. They've also donated their place for us to be able to have coffee and gather with our group as well. And it was pretty well attended the first round that we did this, and it seemed like it was going pretty good. Our initial goals were really to build a stronger connection, increase awareness of available resources, and ensure that our agriculture community feels seen and valued and supported. Because as we know, like I think they're kind of in the background, and a lot of people don't really push for them and their mental health and stuff like that. So that's kind of what we wanted to do here with this program, and keep it very casual, but also letting them know there's resources here in the county. We didn't want to push mental health on them as much because, as we know, the people that we're targeting and the people that work in farm and ag are men. So we wanted to make it very casual, let them know why we're here, that we just wanted to dedicate this time to them and just offer free coffee. And if they ever have any suggestions or things that they might like to see in the community, ag related, this is where they come and connect with us and we get to talk. And it was awesome to have like Emily Lockard there from CSU Extension, because she's the ag director for CSU Extension and she knows a lot about the ag, the landscape. She's met with so many of the farmers and ranchers here as well. So it was awesome to have her on our team and be a part of this program as well. With that being said, we had conducted a survey tailored to the agriculture community that we presented at the Montezuma County Fair this year. It was an in-person survey. And then, so if you attended the fair, you can scan a QR code or you were there to be able to fill out the survey and be entered in to win a gun safe. We had auctioned off we had done a drawing for I think it was a 42 or 46 inch gun safe, a full size gun safe, to tailor or for the agriculture community. So these were kind of the questions that we asked in the survey. We asked and we asked if people were associated with the agriculture community. As you can see, 75% of them said yes and 25% no. We also wanted to recognize the primary sources of stress in the agriculture community. We've noticed that 40% said financial pressures here in Montezuma County. The next one was weather condition, or sorry, isolation and lack of community supports. And then next would be that was second, weather conditions, and then isolation, lack of community supports. So this survey kind of opened our eyes and got to see where the stresses are in agricultural work here in Montezuma County. And it's pretty big, so it will go all the way to like Mancos and Lewis area, close to Dove Creek in that area as well. So I just wanted to show this to you guys. We also asked, we also asked this question, because of agriculture stressors, are you concerned about mental health or mental well-being of the agriculture community? A lot of them said, 50% of them said yes, very. 31% of them said yes, somewhat. And then 10% said neutral, not sure. 6% said not at all, and 2% said not too much. This was kind of concerning because a majority of the people that took the survey, 50% had told them like yes, very. And so that was also a great data tool to see as well. Going on to this, this is the winner of the safe drawing. His name is Carlos Whitmer. He's actually a farmer and rancher in the community, so we were happy to be able to give him the safe. And then these are the big R employees that were able to work with us with the safe as well. So it was awesome to see that the winner, or the lucky winner, went to someone in the agriculture community. Our mission for this whole program, the Cattle, Crops, and Coffee, is to build connection within the community. We are dedicated to breaking the stigma in the community, and even through the agriculture community. We are dedicated to breaking stigma, and even though the agriculture community can be challenging to reach, we want to remain steadfast, approaching every effort with respect, patience, and deep belief in the strength of this community. We want to promote mental health awareness within this community while ensuring individuals know that resources and support are available to them as well. Again, this is our team. I am the coordinator. This is Madison Mahaffey. She's the chair for our connectedness program, and the SAFE program / CNC program is housed here at the Montezuma Public Health Department. So we also want to recognize them. And then our CSU Extension Ag Director, Emily Lockard. So I don't know if you guys have any questions.
Yeah, thanks, Nyona. And we do have a couple minutes left for questions if anybody in the working group, if we want to stop sharing and go back to the full screen. If anybody has any questions, raise your hand. That was really informative, and love all the work that you guys have done out there. That's great. Thanks for sharing. Oh, go ahead, Robert.
Thanks. That great presentation. Thanks for coming. What are some of the biggest barriers that you faced in trying to set up, or that you still face?
Well, I think because this is a pilot program, we've seen good attendance the first round. And I think it's really connecting with the local farmers and ranchers where they're already at. This round, we had actually decided to pick a specific time and place, and to meet every second Wednesdays, right, guys? Yeah, every second Wednesdays of the month, starting from November to March. And we're kind of seeing like maybe they really don't care to be in Cortez. Maybe they are liking that we met closer to them because we got to go to Lewis, the Lewis part of Lewis community, and then Dolores community, and then Mancos community. And I think that was a little bit more meeting them where they're at. And I think it was awesome. I think those are kind of the barriers there. Also, just promotion, and it's a small community, and getting the word out about this program and what it's really here for as well. So
Awesome.
I don't know if anyone else wants to add anything to it.
Yeah, that's what I was going to say. The rest of you guys, thanks for joining the call. Does anybody have anything else to add to Nyana's presentation?
I'd say one of the other big barriers, especially in rural spaces and working in male populations, is trying to reduce the stigma around talking about mental health or suicide, either or both. And so
Yeah.
I think we've seen change in progress over the last few years, but there's still a bit to go to move that mark and to really get those populations to be able to engage and speak more candidly.
Thanks.
Yeah, had great conversations about that, Trent, about how, everybody knows what kind of pickup you have, and if you're parked by a counselor's office, that stigma comes along with that. And so I think all of us talking about it, taking that stigma away is so important. Rosie and I actually had a conversation whether to work with CSU and really include, as like Bob was saying, whether we include veterinarians in this discussion, because a lot of farmers and ranchers are interacting with veterinarians, and nobody's afraid to have their pickup seen at a vet's office, right? And so including them in the discussion as well.
All good points, Robert.
And I would just add on, like, a lot of our meetings that have been the most successful, people at first didn't quite understand, like, so why are you having this coffee? Why are we getting together? But then it was just that community building where then people were asking, oh, hey, Jim, I saw you switched your sprinklers. Oh, who did you talk to about that? And, oh, Emily, are you having a drought program? So it was this informal time for people to just be with each other and enjoy time together. They weren't necessarily talking about maybe the subject that we had gathered them all around, but we came up with wording of how to introduce it without scaring people away. We're a suicide prevention group and we just want to buy you a cup of coffee. But then the conversation was, as Neona said, like very casual, but it was just that building a community. And it is this great partnership with Extension, the health department, that community members that are part of SAFE, like Maddie, that we're all coming together from different perspectives and have different, I don't know, topics of expertise that we can bring to the table that I appreciate as part of the way that we work together.
That's awesome. Thanks. And how many people did you guys have show up in general? Like, was there
The first round, or
was there like a consistent crew that was showing up?
I would say the first one was about 5 to 10, in different areas.
But it could go from one person to 10. So,
sure.
Sometimes you hit it, and sometimes we're like, well, that was a great conversation with that one person. So, let's. So we don't totally have it figured out, but we keep trying, and we'll see what happens in the future.
And these efforts aren't always about the numbers, about the right person being there and you being there for that person. So I think that's amazing. Richard, I saw your hand before we move on. Did you have a comment or a question?
I just wanted to kind of reach out and say thank you. I'm here in Montezuma County, and so I work with the Ute Mountain Tribe, but it's really nice to hear what's going on here in Dolores Cortez and the community. I'm not sure if I could even maybe help your project just to spread the word or something. I would sure love to help in any way I can.
Yeah.
Mr. Harlan, I think I have your email, so I'd be happy to send the poster and everything to you. If you don't, that'd be wonderful. Thank you.
Awesome. And Maddie, was there anything that you wanted to add?
No, I think everyone covered it. I just really appreciate all the hard work that everyone has done for this. I think we're still trying to figure this out, but I think people in the community see it and they think it's needed. And I think we can tell that by the amount of sponsors we actually have for our program. People are engaged and they think it's a good thing. So we just have to get people to show up, but it'll happen.
Yeah, I did love the list of sponsors. It looks like the people were really supporting. That's fantastic. All right, so we're going to move on to our last kind of discussion section of our meeting before we close up. And this is really a reflection on the ag behavioral health. Uh-oh, my computer's screaming at me for a second. Well, we'll trust that it's not going to shut me off. But we all met together in Monte Vista back in November, or many of us. I want to acknowledge that Jacob also joined the call, and he is a part of the Ag Working Group, as well as Mike joined the call. I'm seeing you too, and just want to acknowledge that you guys are here. Thanks for joining. And for this conversation, it's really going to be open to everybody. But the hope was to have a conversation around the behavioral health working group and just kind of get some feedback about that summit. About the behavioral health summit, and kind of see feedback. Carlisle wasn't able to join us. He does have the survey that we took, and he has feedback from that. And overall, it was really positive. People appreciated the networking, the opportunity to connect, the trainings, and wanted to hear from those of you from this working group that were there. If there's anything that you guys wanted to share, and then talking with the whole group about planning for next year. So starting off, anybody who was there have any thoughts or comments that you want to offer?
Well, I enjoyed my time there. I ended up getting so sick. I had to leave, and I wasn't able to participate in absolutely everything. But I really made some very valuable contacts, especially with the Hope in the Valley organization. And I already have somebody placed out there, and so that was really helpful for us to make another resource. Again, my time was short there, but it still was really valuable. I'm glad for that opportunity.
Yes. Anybody else that was there?
Yeah, I was gonna say, I think we heard some really great positive feedback on the roundtables and just networking in general. I think a lot of people wish we had more of that, either informal or formal. So I think that's something we could see next year. But we had some great feedback on networking and just the roundtables that we had.
Yes, there was lots of that feedback.
We had Nick Purchase in the chat say more farmers. Nick was able to attend, and I'd love to hear from work group members thinking about, what's the right balance to strike between connecting behavioral health providers and making it a valuable summit for them, and also including our ag community. What do you guys think are the best ways to do that? We tried having the social for farmers. Would love to hear about, the balance between the ag community and the provider community.
And to give a little background to that, Rosie, the legislation was for us to create a summit for ag organizations and providers and support folks. And so integrating the farmer's voice, to Nick's point, I think is so valuable, because we need to hear what farmers are struggling with. And maybe there's something for this group to continue to explore. What does it look like to also create a space where we're providing a gathering and a summit actually for farmers? But the legislation, as Rosie was talking, did specifically say for organizations.
Yeah, and to Rosie's point, one of the ideas that we've been tossing around is, I think the social was a great idea, but maybe at our next event, we actually make the social at the same location as the summit. And so that evening, then farmers and ranchers know that they can come. The providers can still be at their booths, so farmers and ranchers can interact with them at their booth, and kind of make it that way.
I like that.
I also enjoyed the kind of in-person training for the farm logic that we had with Chad that morning.
Yeah.
I like too that we had and I can't remember her name, but the lady who came and talked about the grief piece, that was just really hit home, and I think just brought something new that maybe not everyone thinks about. Um, and so I really enjoyed that, having something new and different to hear about as well. The other idea that um, Amanda and I talked about on the way back to Grand Junction was um, for our giveaways and things like that. We were both kind of wishing that we would have got like 100-pound bag of potatoes or something while we were down there. So really being able to feature the people in agriculture in whatever area we have um, the next summit. So like if we were to have it in Grand Junction or something, and if we do it in the fall, it's a little bit past peach season, but what is kind of what is the main thing that would be available that we could do as like giveaways and things like that. Being able to purchase, a box of apples or something like that from the farmers in the area to really kind of highlight them and their produce or whatever it is that they have to offer in that area. If we had it in Cortez or Dolores County, we could do like beans and things like that, the Anasazi beans and whatnot, as just one thing that comes to mind. I know there's other things produced down there as well. We could do the wine here in Mesa County as well. So just keeping that in mind for future.
I love that. Thanks, Julie. That was something that we did mention at different times. How can we make this supportive to the community? And that is a great way for us to do it. So I love that
Yeah, I love
feedback
that
and
idea
thoughts.
as well. And we came to the idea too late to get it organized, but we were tossing around the idea of having an optional farm tour in the afternoon of the second day. And so like trying to get the providers who showed up actually out on a farm, I think would be a really great opportunity to see in real time the tangible stressors that farmers are dealing with. And then maybe there could be a shopping opportunity at the end of that farm tour. I would like to make that happen for next year.
Yeah. Wendy, anything that you want to say from somebody who wasn't necessarily part of the planning but was able to attend and participate and share?
Of course, I got there late on the first day, so I didn't see a lot of the stuff. One of the things that I did notice that there weren't a lot of producers, and I don't know how to get them to show up because having champions in the community that want to talk about their mental health is huge. Um, and so maybe Farm Bureau or somebody could make it an incentive to get some of them there, that they could be there.
I think
Yeah,
we can definitely advertise this thing going forward. There's no question about that. And my apologies for now for not thinking of this ahead of time before this one. But I think going forward we can certainly do more of a push on our social media and whatnot. I think I'll just say one thought in that, and I'll say this with I did not attend this meeting. I was going to, but had a last minute glitch, and so couldn't. But there's also part of me that wonders how many would be willing to do this in person if they're looking to remain anonymous too. So I don't know, and just not want to be so outright about it. So that's just one thought that I have. But I agree we should have more farmers, but maybe the expectations, um, should be in
Another
check.
suggestion
Well,
is a lot of the county commissioners are farmers, and
yeah.
maybe extending it out to CCI and having them help promote it. Because I know that that's where I came from as a county commissioner. But I think that bringing them in and CCI partnering, and I can't remember what the other county commissioner group is, but that would help spread it too.
Mm-hmm.
Yeah, that's great. idea, Wendy. And so you know, because JC said this coming year we should really be aggressive on our outreach, and so we're going to take advantage of Tony Haas being president of CCI this coming year and try to go to their meetings. You know, they're so busy as well that if we can go to some of their meetings, I think that'll really be a benefit.
And I will do the best I can help too, because we're doing outreach right now too. So I'm putting lots of miles on my pickup.
That'd be great.
Well, for next year, we also talked about including more FFA chapters, and then also using some of those USDA resources like FSA, NRCS offices, conservation districts, maybe using some of those avenues to also reach producers.
Yeah. Anybody who wasn't at the summit, but in thinking about this, putting on another statewide summit, what are some ideas that you have for engaging folks and getting them there? Again, the legislation specifically charges us to put on a summit for ag organizations and behavioral health providers to come together to figure out how to best network and train and get people that are supporting farmers and ranchers. I'm hearing from this conversation that there's a strong appetite for us to also figure out how to include more producers so that not only is their voice there, but that we're figuring out how to support those that want to either be peer leaders in their communities or are interested in learning more about the resources and services that are available in the state. So would love to hear from any of you that may not have been able to attend, but that have some strong opinions or have opinions. And I see a hand raised in the corner. Jacob.
You said strongly opinionated, and it just called my name.
Excellent.
I think
We're
this was
grateful.
in previous conversations with Carlisle and the crew planning it, but I know Monte Vista and the San Luis Valley is a great area that's been doing a lot of work in this area and has a lot of great agricultural production in that space. But I also think if we can't get it somewhere kind of central for folks, then at least keeping it bouncing around the state so that each year we hit a different geographic area. Because I think it was really hard for Northeast, Northwest, just kind of north to make it down. And so if we can keep that at least rotating around the state would be good to spread the wealth.
Absolutely. And I mean, that's a big question. Hopefully we will be able to continue doing this, for many years. We have funding through 29, but how do we move forward with making that decision? I had multiple people reach out after the summit and say, hey, I'd love for you to come and have it in our community. And it was funny. One person was as far east as you can get, and the other person was as far west as you can get. And I'm like, oh, that'd be awesome to have it in both spaces. And so how do we move forward? And Jacob, as you're talking, as we heard, Wendy talk, the Southeast is, the most underrepresented area of the state in most behavioral health stuff. And I think it'd be great to figure out how we get it closer to folks. So what are thoughts on here, how we do this?
One of the ideas that Rosie and I again are talked about is that try to identify that again, that other location that we're going to have the summit at, and then our in-person work group meetings have it on the other side of the state.
Yeah.
And then really reach out to those host cities for our work group meeting in advance, again, to almost make it like a mini summit. So try to get the local people engaged, have local presentations from the groups there, have local producers there. And so that's how we could, I think, maybe engage more of the state by organizing those two events.
Yeah, and the work group meetings, maybe extend them, Robert, so that they're not just an hour and a half or 2 hours, but that it's like a half day engagement. I like that. Tim, I see you with a actual hand up.
I was sitting here trying to figure out how to raise my hand on here. I couldn't find it. Thank you for recognizing that. I wasn't there, but I am curious in terms of, because it went over 2 days generally, right? Was that enough or too much? I'm thinking about this just for logistics purposes. I'm having a wild idea about like, well, let's go to them. And, this was held in November this year, and our annual meeting is held in November as well. I don't know if there's a way to parlay that possible attendance, if we want more producers there. But I'm just wondering what, just, as far as like the length of the actual, this annual one, this inaugural one itself, what the thought process or what everybody thought is, if we want to shorten it or keep it the same.
For my 2 cents on the length of it, I thought kind of a day and a half was about perfect because you could get in the night before, connect with some people, spend that day, have that sort of informal connection as well, and then still be able to get out across the mountains before it got too dark. But so I felt like that was fine, but I would show up regardless of whether it's one day, a few hours, or multiple days. I thought it was really fantastic to connect with everyone in person and just be able to spend some time hearing more about the great work that's being done. So I'd welcome any opportunity, but I've got some flexibility. So
Others?
Good afternoon, everyone. This is Michael Geen with Southern Ute Indian Tribe, and appreciate the opportunity to be a participant on this work group. Just a thought here, here in Southern Ute in Southwest Colorado, just adjacent to Ute Mountain, and good to meet you, Richard. I heard it was mentioned FFA and some of these youth organizations. I think that's going to be very important as the future farmers, the future ag producers, cattle ranchers, even horse folks, because we are struggling. And for us as Southern Ute, just to share one of our biggest dilemmas is as a government working with tribal members and also with tribal trust lands, there are lands that are assigned to individuals who have an obligation and responsibility to manage on behalf of the overall membership. So they're given this grant of assignment. And what we're experiencing right now is the industry, the practice, and probably the desire is definitely dwindling and being lost. And those that have retained the knowledge, it's slowly passing. And what we're struggling with is actually getting this interest where, we're talking a young population that's going to have to assume this role and responsibility. And it's begging that question of how. And as an example, my son, he's 37, and I always have to apologize every time I talk about this story to him because I failed him in teaching him what I knew because I was under the assumption that he did not want to learn this. And probably for the most part, he didn't until most recently here in the last 5 years. So at age, 32, he's picking it up and he's learning a lot. He's researching a lot and he's expanding his knowledge base simply by research. And where I work here with the tribe as the treasurer, I don't have the time to be out there with him. So we're always communicating text wise or phone calls. Hey, Dad, what about this? What about that? And I have to force myself try to remember a lot of this because I hadn't practiced it in a while. But the point being here is stress does hit the younger population as well and has. In one case, I actually had to, I'm just using the phrase, talk him off the ledge. He was getting so stressed because he couldn't figure out what he needed to do. He was stressed about the tribe and the operations and the lack of the federal government fulfilling the responsibility, let alone the tribe. So I had to keep him encouraged because he was ready to quit. He was ready to say, I can't do it anymore. So that along that line, it just begs that question of how many other young individuals are suffering the same thing with that responsibility, especially from generational farming and ranching and the handing down of this operation, because the older generation are retiring, getting older, and needing to pass it on to the younger generation. But is our younger generation really ready to fulfill that role and responsibility? Because finances is a big issue, knowledge is a big issue, and of course the modern technology. I think there's opportunity that we just haven't really sought out. AI is one of those, and we're looking at how do we educate our youth to become more knowledgeable and not fearful. and end up on the ledge because they had no idea what they were getting into. So that's just a thought on my part. Thank you.
Thanks so much, Mike. I'm curious too if you have thoughts around how we can better outreach and engage the members there in your tribe to get them involved in this conversation. Is there something that you could imagine they would be interested in participating in or attending?
Well, one thing I did last year, and it's going to be my goal this coming year, I went ahead and sponsored what I called a ag producers gathering. I didn't call it a meeting, just a gathering where my son and I, we sponsored it ourselves out of our pocket. And we went around and talked to some of the local vendors. And, they provided a bunch of stuff that we actually had drawings and giveaways and we actually cooked for the group. And we had like 50 people that showed up.
Wow.
And we talked, and it wasn't a presentation. That was the first thing I told them. This is not a presentation. This is a conversation of what is it you're needing? What can we do? What are we failing to do? Things of that nature, where it engaged them to have a conversation, not sit in the audience and just listen to what was being presented, because we see that happen a lot where people have not been able to ask questions, let alone get engaged in the conversation. So it was an open forum, and that was received very well. So we want to continue that kind of that. What was the presentation in Montezuma, the cattle and I forget what it was called. Anyways,
That's right, cattle, crops, and coffee.
yeah, exactly. Very similar. And that actually crossed my mind to say that's kind of similar. And I think with the youth, we actually have programs here. We have an ag division. We have a new ag division head, and he's going to be reaching out to these S&Es to find out what exactly he needs to be providing to the membership. And of course, we have our own behavioral health division within our health department. And I think for me, it's just a matter of connecting these two divisions with the membership to say, what can we do to help and listen, really listen to what the needs are. And especially with the fact that I think the stresses are going to be hitting just due to our tribal code that's going to be revised and implemented, which is going to have a huge compliance component. That if you fail to comply, you may end up losing anywhere from, whatever your land assignment may be, a few hundred acres to, minimum maybe 10 acres. And a lot of these are kind of the entitlement aspect of it's been in their families for generations, and we're seeing that the younger are not able and probably just don't have the knowledge. So I think we're going to have to communicate and bring them to the table and just simply say, we know we need to do more to help you. What is it we need to help you with? So that's kind of the thought process for the coming year. And there was one other council member that was very active in this, and he's actually running for re-election come Friday. We'll be having our runoff election. Whether he gets in or not, we'll continue with the plight to help our members as best we can. And some of it is simply these federal programs that are out there that the people don't understand. So some of it is communication. And when we look at misunderstanding or lack of understanding, it does create those stresses. And those stresses, create I think the mindset that why even bother? Why even put up the effort? And they give up.
Yeah, thanks for sharing. We definitely hope that this group can continue to support efforts to support the next generation and keep folks that are engaged in agriculture hopeful and moving forward and not giving up. So thanks for sharing that. I look forward to you continuing to bring your insight from the members of your tribe to this working group. Thanks for being here. Jacob,
just one other
one more thing. Yeah.
Just from the thought of how to get more producers engaged.
Yeah.
Just listening, maybe start looking at some of these county fairs, that time frame, and because people are gathering for whatever reason, whether that's showing animals or produce or whatever. And same here with the tribes, we do have our annual fairs as well.
Yeah.
So just sharing that. Thank you.
I like that. Thanks. Jacob.
Kind of going off of what Mike was saying and Tim earlier, as we're talking about how to get more producer type folks involved. I think knowing speaking from the other folks in my age group and ag producers, I think depending on how we frame this, if we frame it from the lens of we're going to come and talk about the stigma around mental health and these kind of things, you're just gonna keep seeing my face and some other folks. But I think if there's room to switch that producer part to a tangible skills, this is how you do generational planning, financial planning. These are some tangible skills of how you deal with these stressors and do it as that. So there's that, beginning the provider part, the overlap between providers and producers in some meaningful way, but then that chunk that's focused on getting more youth and ag and producers involved is more around those tangible skills they can take away to reduce and limit stressors. And if that makes sense.
That makes perfect sense, and I completely agree. Not that we are hiding our vision or our intentions, but that we are making them tangible so that they address the issues. That's great. Thanks, Jacob. And always value your insight around that next generation with all the work you've done around future and next generation farmers with Farm Bureau. So thanks for adding that. We're coming to the end of our time to kind of discuss the summit. We will continue this conversation and hope to make some decisions in January. So we'll probably put this back on the agenda to give some updates on where the summit planning committee is. But before we move away from it, Robert, I see your digital hand raised.
Yeah, thanks. I just wanted to answer Julie in the chat, put, are we limited to just 1 year? And once a year, I would presume what she meant. And yeah, so the legislation only allocated $7,400 for a single in-person summit. But that, I don't think there's any restrictions in place that if the work group feels that this is really valuable, that if we find outside funding, that we could help organize and support other efforts from across the state. So that's, I think, a discussion item for the work group.
Yeah, that's an important one. Thanks. Okay, so with that, I'm going to pass it over to Rosie and Robert to give us a Department of Ag update and bring us home. We got 10 more minutes. Actually, 9 now.
This will be quick. We'll keep it brief. So as everyone knows, we made a change to our charter that has some attendance stipulations. So for unexcused, we'll say, to use a school term, absences is the maximum that we would hope to see from any work group members. For any time that you are not able to join the work group meeting, we understand you guys are juggling tons of jobs. This is a volunteer position, but we would love to have continuity from meeting to meeting. So if you can send a proxy in your place to the meeting, so maybe someone you work with, someone who you think could be interested in learning more about behavioral health, and can report back to you what happened in the meeting, that would be great. I also think it would be a cool opportunity just to have more people showing up to these meetings and learning about what we do. So in order to do that, if you can just send me an email with the email of your proxy stand-in 24 hours before the meeting, I can send them an invite and we'll have them join. That would be great. So even if it ends up being, kind of last minute sickness, things like that, we can still send them a link quickly and have them join. And on that note, we're thinking of just continuing with the fourth Tuesday of the month at this time. What does everyone think about the time? Obviously, we had to change things for the Thanksgiving, Christmas of it all, but that seemed to work out. Thoughts? I'm getting thumbs up. Okay, cool. That's easy. That's great. We'll just stick with the same time. Nice and easy. I will get all of those dates posted on our calendar invite, and then also on our website, and folks can start registering. Public individuals can start registering for those future meetings. The last thing that I want to talk about is our legislative report. So this is the first year of the group. There are growing pains. Robert and I did not know the amount of time that is required to be reviewed by both our CDA commissioner's office and then also the governor's office. So I apologize for the rushed nature of the legislative comments. Thank you so much to the folks who went in that document, who emailed me suggestions, who called me with suggestions. We were able to get all of those in there. But for next year, we will move up that process much earlier. One, so we have more time to review together. And two, because we also learned that when it comes to the policy recommendations of this legislative report, we do have to be more formal than I understood. So as we did with the charter amendment, where we had it written out and then we brought it to the whole work group and had a discussion and then brought it back to the work group for a vote. That is the kind of formality that we are going to have to take when it comes to policy recommendations. In hindsight, that makes perfect sense. It can't just be me and Robert from CDA typing up this report. It really needs to come from you all and be done in a pretty official capacity. So I'm really excited for that process next year, but I just want everyone to be thinking along that kind of timeline. If you're thinking you have this brewing idea of here's what we should talk about for a policy recommendation, we got to be thinking, at least like 2 months out from when this report is going to be due to incorporate those. But that being said, our report did get sent off. It's going to the Gov's office. And I will include a copy of what ended up being our final draft in the follow-up email this month. Robert, do you have anything else to add?
No, hats off to you, Rosie. Thanks for all your hard work in putting that report together, and everybody else that contributed. I think it was great. And I think similar to what we did this past year, maybe the outreach committee, one of the committees, we can work on a work plan for the year and outline deadlines for each month. So, have policies in place by August, for example, and the draft report or something. So we kind of have those target dates. So I'll work with you in kind of lining that.
That's a great idea. And that is a plug for this Friday. We are having our communications and outreach subcommittee meeting. The meeting is at 1:30 to 2:30. Liz is going to be chairing up this subcommittee. A huge part of her job is going to be outreach and events. So we're very excited. So if you're able to attend that meeting, we are going to be talking about our outreach and communications plan for the year. We will obviously bring it to the full group as well. But if you want to dig into the nuts and bolts and influence our plan for the year, please try to attend.
And unfortunately, I won't be able to make that. I will be on the road driving to Texas, but I look forward to Liz taking that on and participating in the future. We do have a couple of minutes left. Thanks. I do want to give Rosie a huge shout out for all your work putting that ledge report together. It really was a much bigger bear than we were originally planning, and you really did do it with grace and gusto. So thank you for that.
Thank you.
Yep. And then I also wanted to throw out the in-person thing that Robert mentioned earlier. If we're going to do some in-person meetings next year, I'm even thinking that maybe we do the summit, but then we try and do 2 optional in-person meetings, and just wanted to get feedback from folks if that seems reasonable. Obviously, we'll make them hybrid if one's on the east side and one's on the west side, but do people support doing another in-person meeting like we did down in Pueblo this past year? And we'll try and get it on both sides. Okay, I'm seeing head shakes, so we can, and thumbs up, we can continue working with that. Any questions or comments or Q&As from the community members that are watching before we jump off? We like to give you an opportunity to comment or ask a question. Really appreciate you supporting, and all of you working group members that are on. Thanks for taking time out of your schedule to be here. Lena, thanks for being apart from the CDPHE. We miss Catherine, but appreciate you being here and want to welcome any comments or questions that you have along the way. Jacob, a real hand.
I threw an image in the chat. It's not till March 24th, but Shauna Brown, she's the ag teacher in Holyoke. Her and the extension, the folks up there put together a legacy showing. She just sent it to me, so thought I would share.
Cool. Thanks. And I guess we can close out and ask if anybody has any other community events that we should be aware of that Rosie can put in the calendar. If you don't think of it right now, you can always email Rosie and she can get it put in for us. And we got like 1 minute left. Any closing thoughts from anybody?
Just Mike. Just want to wish everyone a happy holiday season and be safe and stay warm.
Right on. It does look like it's going to be warm for us. At least the weather outside is warm. I don't know if that's a real Christmas song, but we could make it one maybe. Anyone else? Really good seeing you guys. Go ahead, Richard.
Mike, Tavuche Tawoyak.
And with that, thank you all very much. Excellent. Okay. Happy holidays. We'll see you in January.
See y'all.
Thanks, everybody.